Lower digestive system disease. Gastrointestinal infection. Incubation time range from 12 hours to 2 weeks. Symptoms appear 1 to 48 hours after ingestion of the toxin. Infection and intoxications cause A. Diarrhea, B. Dysentery, C. Gastroenteritis. Usually treated with fluid and electrolyte replacement. Stomach pathologies are inflammatory in nature. 2. Conditions. Gastritis, peptic ulcer disease. Predominant organism, Helicobacter pylori. 2. Virulence factors. 1. Rapid motility penetrate the mucous blanket lining the stomach. 2. Urine production. Large amount of ammonia from urine that leads to neutralization of gastric acid. Helicobacter peptic ulcer disease. Helicobacter pylori produce ammonia with neutralized stomach acid. The bacteria colonize the stomach mucosa and cause peptic ulcer disease. Risk factor for gastric carcinoma D. B-cell lymphoma mucosa. Associated lymphoid tissue. Hepatitis. Inflammation of the liver. Symptoms include A. Loss of appetite, B. Malaise, C. Fever, D. Jaundice. Viral cause of hepatitis include A. Hepatitis virus, B. Epstein-Barr virus, EBV, C. Cytomegalovirus, CMV.
Good morning everyone, I'm Divine Joy E. Pascual, reporting about small and large intestines of gastroenteritis. Diarrhea, defined as a change in the normal bowel habits of an individual, such as increase in the frequency, fluidity, looseness, and volume of feces excreted per day in comparison to the usual fecal output of the individual. In a normal adult daily weight, stool weight less than 200 grams, 65 to 85% is water. Diarrhea implies daily stool production in excess of 250 grams, 70 to 95% water. It is the final common pathway of intestinal response to many including agents and serve as an adaptive mechanism to get rid of noxious material. Bacillus cereus gastroenteritis, ingesting food contaminated with the soil saprophyte. Bacillus cereus can result diarrhea, nausea, vomiting. Staphylococcal food poisoning, ingestion of an enterotoxin produced in properly stored foods. S. aureus is inoculated into foods during preparation. Food with high osmotic pressure and those not cooked immediately before consumption are most often the source of staphylococcal enterotoxicosis. Cholera febreus. Ingestion of other V. cholerae serotypes can result in mild diarrhea. Fibrogastroenteritis can be caused by Vibrio parahemolyticus, Vibrio vulnificus. These diseases are contracted by eating contaminated crustaceans or contaminated mollusks. Clostridium perfringens. Clostridium perfringens causes a self-limiting gastroenteritis. Endospores survive heating and germinate when food, usually meats, are stored at room temperature. Exotoxin produced when the bacteria grow in the intestine is responsible for the symptoms. Diagnosis is based on isolating and identifying the bacteria in stool. Clostridium difficile associated diarrhea. Growth of Clostridium difficile following antibiotic therapy can result in mild diarrhea or colitis. The condition is usually associated with healthcare environment and daycare centers. Clostridium botulinum botulism. Clostridium botulinum is anaerobic, root shape is performing that produces a protein with characteristic neurotoxicity. Under certain conditions, these organisms may grow in foods producing toxins. Botulism, a severe form of food poisoning, results when the toxin-containing food are ingested.
Escherichia coli has 5 pathogenic groups. It has enteroaggregative E. coli. Its strains cause diarrhea. Enterotoxigenic, major cause of traveler's disease. Enteropathogenic is important cause of diarrhea in infants. Enteroinvasive and enterohemorrhagic produce Shiga that cause inflammation and bleeding. Severe abdominal cramps which begins suddenly along with watery diarrhea that may become bloody. Also has vomiting, fever or mild fever. Treatment and preventions are trimethoprim sulfamate toxazole for short-term, fluid electrolyte replacement, doxycycline, ciprofloxacin, and properly cooked food and purified water. Salmonellosis or Salmonella gastroenteritis. It has 3 clinical findings. First is enterocolitis, which begins with nausea and vomiting, which progress to abdominal pain and diarrhea. Second is typhoid fever. Fever, bradycardia, constipation, and the first week will be high fever, delirium, abdominal tenderness, and splenomegaly. Third is septicemia. This is with patient with underlying disease, fever with little or no enterocolitis. Shigellosis. As dysentery has significantly responsible for epidemics with high mortality. It is transmitted by food, fingers, flies, and farmites. Clinical findings has lower abdominal pain, fever, bloody, mucus, diarrhea with tenesmus. Treatment is fluid electrolyte replacement, ciprofloxacin, ampicillin, doxycycline, trimethoprim sulfametoxazole. And the prevention is sanitary control of water, food, and milk, proper sewage disposal and fly control, patient isolation and disinfection, detention of carriers, and prompt antibiotic treatment. Campylobacter gastroenteritis is the second most common cause of diarrhea in U.S. It is caused by Campylobacter jejuni and it is commonly transmitted by cow's milk. Yersinia enterocolitica. Urease positive rods transmit by meat and dairy products, cause inflammation and ulceration, has early symptoms, fever, abdominal pain, diarrhea, watery to blood. 2 weeks after, it can cause arthralgia, arthritis, and erythema nodosum. It is self-limited and don't require antibiotic. Vibrio cholerae. Nausea and vomiting and profuse water diarrhea. Stool resembles to rice water. Treatment and preventions are rapid fluid and electrolyte replacement, tetracycline, isolation, health education, and improved sanitation. Vaccine if available.
Ergot poisoning. Ergot poisoning happen when a person or animals consume Claviceps purpurea and its byproducts. This fungus grows on grains such as rye and wheat, producing toxic alkaloids. Aflatoxin poisoning, caused by eating contaminated plants products or consuming meat or dairy product from animals that ate contaminated food. Giardiasis is a diarrheal disease caused by the microscopic parasite Giardia duodenalis that is spread through contaminated water, food, surface, or objects.
Cryptosporidiosis is an infection that causes diarrhea in immunosuppressed patients, and it is caused by a parasite found in stool. You can get this infection after eating food or drinking water that is contaminated with stool. Cyclospora diarrheal infection. Cyclospora infect the small intestine, bowel, and usually cause watery diarrhea with frequent and sometimes explosive bowel movement. And the common symptoms include loss of appetite, weight loss, stomach and cramps, pain, bloating, increase, and nausea and fatigue. Amoebic dysentery is caused by Entamoeba histolytica growing in large intestine, which is spread to human feces. Poop. Often there are no symptoms, but sometimes it's cause diarrhea, loose stool or poop, nausea, and feeling sickness in the stomach and weight loss.
Hi, morning everyone. I'm presenting is hydatid disease. What is hydatid disease? It is a human infected with the tapeworm Echinococcus granulosus might have hydatid cysts in their lungs or other organs. Like dogs and wolves are usually the definitive hosts, and sheep or deer are the intermediate hosts for E. granulosus. And the second one is trichinilosis. It is a larvae and cyst in muscles of humans and other mammals to cause trichinilosis. Garbage including undercooked or raw pork. Ingested cysts develop into adults in the pig's intestinal wall. Adult worms produce larvae that encyst in the pig's muscle, and also meanwhile, other animals eat infected meat that has been dumped, and human eats undercooked pork containing cysts that are infected to humans or animals that ingest it. Kapag hindi gaanong naluto yung pagkain na kinakain natin, magkakaroon tayo ng trichinosis